Quality of life medicine, usually the goal of the treatment is patient satisfaction. I tell them what I know, what we can do, and then let them decide, because it's their life. As you see both patients, penile implant patients and prostate cancer patients, when you do the consultation, preoperative consultations or the outpatient visits, is there any differences?
It is. So because we have a very unique situation now in the hospital, I have to cover some other areas, and prostate cancer as a special one. So, and my hours are, I have about 20% of the patients with prostate cancer and 80% with erectile dysfunction in one day. So I can immediately compare both groups of the patients. So if the patient, he has no idea what's happening, but he has a diagnosis, a biopsy and a PSA, and everything is finished, is done, and he needs maybe 10 minutes to be informed about his disease and the methods of treatments, and he knows there's just a few options for him. And actually there are only two options, to die or to live. That's only two options. And of course he decided to get the last one. And if you have a patient with erectile dysfunction or problems with erection, you need more time, and you have to be really patient, because there are a lot of options. And one of them, maybe not the worst one, to do nothing. Maybe he will be happy without erection and without erectile function. And besides, Dr. Wilson told us today that 20% of the patient, they do not use the penile implant, but they feel better with the penile implant. So this category of the patients complicated and different than patients with prostate cancer.
I think there's as I only see the penile implant patients, I never decide what treatment he will get, because how can I know his preferences? Let's say what kind of treatment he likes, what kind of things they want. Nowadays, patients knows better, because they study a lot on the internet, or they tried many of the other methods. So I just give them options. I tell them what I know, what we can do, and then let them decide, because it's their life. And quality of life medicine is usually the goal of the treatment is patient satisfaction. So that's why I think we have a less problem or less dissatisfaction with the treatment we offer them afterwards.
Do you know this great paper which was created and wrote by London Torst with his course criteria to pick up the difficult patients? So you have to be very careful within this 15 minutes or maybe 20 minutes maximum of your time to find out what kind of person do you have as a patient, because some patients have unrealistic expectations. And important is, to my opinion, three things in this relationship. One is this: you have to respect your patient. Doesn't matter whether he likes him or not. You have to respect him as a person. And the second, you have to treat him as a known father or a son. That is my criteria. I always try, even if the patient doesn't like me, you feel it, because if you start to talk to him, you feel that something wrong with the patient. But try to stay quiet and try to give him all information you have, but you shouldn't lie. You must be realistic. And the third one, I think it's mostly important. You shouldn't lie, and also to yourself. So you must, maybe in this situation, in this short period of time, realize what is really good for the patient, what is not good. Maybe penile implant is one of the options for this patient, but maybe it's not a good one for this particular patient. And I think we should learn more about this, patient education, to choose the right patient and the right decision, the right indication for this particular patient. And of course you should know who are you and what can you do in this situation. Not try to be a hero doing something which maybe it produced complications.
What was the most valuable thing you got throughout this prosthetic urology practice for the past years?
Well, the first one is the patients and the patient psychology. I learned a lot about patient psychology, as well as a partner psychology and relationship between men and women, which is really difficult. You can write tons of papers on it. And so the human sexuality is such unique. So I learned a lot of it, and we have a lot of things to discover. And another thing, which is mostly important for me, I found a lot of friends among the urologists and penile prosthetic surgeons all over the world, and one of them is for sure you, Mr. Park, and Dr. Wilson, and other doctors. We have a great meeting tomorrow. I hope you will enjoy staying in Kiel, and you're always welcome to visit you as well as your team. Thank you very much.
Okay, I think I can summarize your answer in this sentence. You got happiness out of your prosthetic practice. Am I correct?
Yes, of course, definitely.